good afternoon, good evening, wherever you at. My name is Israel, and I'm a respiratory therapist. I work at the cardiopulmonary unit, which deals with chest and lungs and heart.
I'm Megan. I am a labor nurse, so I work on labor and delivery. I deal with the moms, not the babies. I don't do babies.
So everywhere we go, we always find the same question from people. They want to ask us about, oh, hey, how's COVID? What's going on? And, should I take the shot? Some individuals will come up to us and be like, it's not real, it's fake. You get your conspiracy people. And I won't say conspiracy people because everybody has their own conspiracy with something in life, no matter what it is. So me and my wife decided, it'd be a good idea to make a video where you can hear from the people who are involved in it and who do this and see this stuff every day. You know what I mean? So yeah, because most people, when they see me, it's cool. They ask me, they're like, oh, you're a hero, which I don't feel like one. I just feel like an individual doing their job. But then they never ask, how are you doing? How is it affecting you? What are you going through seeing certain things every day? So this is not to push an agenda or anything, but this is actually to encourage people to get their shot. Because, some of us will go, well, I've never gotten, for example, me, I haven't never gotten COVID, and I've been in there now like a year and some months dealing with it. And so it doesn't mean, though, that I shouldn't get the shot, where if I can go to the store or go to my parents' house or go to somebody with a weak immune system, and that they won't get it. Because most people are like, well, I don't need to take the shot but it's more like we need to look at it as a unit. You know what I mean? As a whole team, as everybody, that, you want everybody to be safe, because you never know who you might pass it on to, because some people have COVID and never know. So I could have gotten it and never knew about it. So this is actually to push people to get this shot and to give more a better perspective of what everybody's going through, so they can be appreciated better.
Yeah, I don't deal with COVID that much, to be honest. Being on the labor unit, our moms are generally young and healthy. So the ones that do test positive don't even know that they're positive. A lot of them don't even have symptoms. And our moms that are sick are really sick. One thing I've noticed is that the moms that I have had COVID positive, not starting well, like in the 80s, some way, somehow, their babies look really good on the monitor. I'm talking in utero. So those babies look good. Right now we have a mom who's really, really sick, not doing well, thinking intubation, but her baby's fine. So I haven't seen the negative aspect of it with our moms. But like I said, I don't deal with it every day. I have been exposed every day. Still haven't caught COVID. So iffy about the shot. But I mean, I get the flu shot every day, every year, because I have to. So we'll see.
Yeah, so this is actually more of an educational video, and so that people can see, as I said, and it hopefully gives you a broader perspective and understanding, because some people on here go into detail about it. Some people are just, quick answers. And it wasn't even practice, because some of the people who agreed to do this were scared, like, oh, come back tomorrow, come at this time. But like I said before in my other videos, I don't like things that are practice. I want you to get the genuine, original idea and what people really feel like, you know what I mean? So yeah, and thank you to the individuals who participated and helped out on creating this, and those who viewed the video before I put it out to see if everything's good. But hey, this is it. Thank you to everyone once again. Hopefully this teaches people something and people stop, the conspiracy of, oh, is it real? Is it? From my perspective, it is real. It is, like my name is real. It is crazy. And, you get immune to a lot of things, because I'm at a point where I feel like I have no feelings, because yes, I do see people die all the time, but this is on a bigger scale, and I need you to go get your shot. Be a responsible person, because, when you go everywhere else, and especially I know people like, well, I want my freedom. I want to go do what I'm used to doing. Oh, the mask, oh, this. But it's not about that. We're not all doing whatever we want. We're not all, being free and just not wearing masks. We all need to work together as a unit to, get things going so that we can be over the stage in our life that is really horrific, because you don't see it. You're not at the hospital. If you've never had a family member pass or something happen or you get it, you don't believe it. I have patients where they have it and I'm trying to explain like, hey, you need to keep a certain equipment on that's keeping them going, or you need to follow these protocols. And they're like, no, I've seen it on this and that. This person said it's fake, or I went online. And, so this is more of the horse's mouth. You're getting it from the people in the trenches, the people who are dealing with this every day, and it's people from different backgrounds. I didn't just go to the nurse. I went to pharmacist. I went to, radiology. I went to the housekeeping. I went to the cafeteria. I went to the doctor. So this is a broader perspective of what, everybody sees in there. So once again, thank you for everybody who volunteered to do this, and go take your shot. Wear a mask. Hey.
Hey.
How you doing?
I'm fine, dude.
What's your name?
Dr. Brandon Lawrence.
And what department do you work?
I'm an emergency medicine physician.
So the question that we've been asking everybody is, so what differences have you seen, major ones, pre-COVID and now that there's COVID going on?
You got to break that down into work versus not work, right? So work is just like in not work, it's unrecognizable. So usually in the ER, everyone's pretty high spirits. We keep each other motivated and kind of goof around whenever, we're able to. And now everyone's pretty stressed and kind of pissed off all the time. And everyone's stressed a little bit more thin. We see all these reports of ER volumes down. And well, that's kind of true, meaning that we have a little bit less ER traffic coming through the door. Everyone that does come through the door is quite significantly more sick, stays in the hospital a lot longer. And it really is a tax on the system. So we have ER nurses caring for admitted patients that are admitted for days, particularly sometimes ICU patients that are admitted for, an entire shift. That's who they're caring for. And that's not normally their specialty, and they're normally seeing more than the 2 patients that an ICU nurse generally sees. Granted, in times of COVID, they're seeing more than 2 ICU patients as well themselves, but it's just, it's a lot more taxing on the staff of the ER. Obviously, we're seeing a lot more death. Not a fun thing to have daily. It's very unsettling, and at times we feel a lot more numb. I'll come home some shifts and I don't even really process it, that it was kind of a shitty shift and we had a couple people pass away. And then sometimes I come home and it just kind of profoundly hits me and I have kind of a shitty night and, have to vent about it with friends or my wife or, whoever. Outside of the hospital, obviously, it's changed the landscape of how we live. I'm fortunate that my kids are both young. They're 4 and close to 2, so they were not in school. Well, one of my kids was in school for 2 days a week, but we just pulled her at the beginning. Pause it. Do you need to go? Okay. Fortunately, I was able to just do, we were able to hire a nanny because my wife works from home anyway, so that really didn't change much, and they've been helping us she's been helping us while both of us are working and helping with education of the kiddos and stuff. But obviously we can't take them to do kid things. I worry about the 2-year-old because a lot of their learning is through facial recognition and stuff like that. So I worry about younger kids that they're not out, seeing strangers and seeing family and learning in more of their kind of tactile and visual ways. And then obviously, we can't go anywhere. So it's been a strain kind of on the family unit because we're just always together. And if there's issues, there's going to be issues, and you can't escape it.
Yeah, because even right now they say suicide is up, mental illness stuff is up, and
that stuff's up because there's A, no escaping it, and B, the resources aren't there either. So especially for kids, when you're talking about if there's abuse issues or depression issues, a lot of that's caught by teachers, and we're not seeing teachers.
Do you hear
right now.
anything from other doctors from other states like California or anything like that?
California is basically on fire right now. So they're essentially New York from the early of the pandemic right now. They're running out of oxygen. People are dying left and right. You take our situation, you times it by 4 or 5, and that's most of LA right now. That's not all of California. That's most of LA, and it's just really rough there right now.
And have you taken your shot?
Yeah, I got my vaccine. I got the Moderna, and I have a side effect to report. I have less anxiety.
Hey, good stuff. Now, so for the future wannabe doctors or doctors right now who are currently in school, do you have any advice of if they ever face this, or even if they just basically want to do what you're doing?
Well, medicine's going to be different. It's I think we're going to be dealing with this shit off and on for quite a while with the way this virus is mutating, and there's the lack of longitudinal immunity from the vaccines. That they think it's only going to be a year, so this could be something that we deal with for many years. For the ER, it's going to be tough. Like the ER, the ICU are the ones affected the most by this, and you really you need to have an outlet. You need to have emotional support, and if you have those sort of things and you're of sound body and mind, then you should have no problem doing this.
Okay, thank you for your time.
Yep.
I appreciate it. Hi.
Hi,
What's your name?
I'm Brittany.
Where do you work?
I work in the emergency department. I am the full-time clinical coordinator, which is just a fancy name for being in charge every time I'm here.
So we're going around asking everybody what differences have you seen pre-COVID and now that we're in COVID. You could talk about anything, work stress, workload, how you deal with it here, how you deal with it at home. What are you seeing?
I will tell you the expectations of not just my job title, but everyone's job titles for healthcare workers has significantly increased, as well as stress levels. People expect more from us and to get paid the same amount of money, which is always a huge factor. Money is always a huge factor, but now it's 10 times worse. Our expectations as healthcare workers are always significantly high. We save lives, especially in the emergency room. We take people that are completely dying, fix them, get them on their way, get them to go home, and now it's not like that. So again, our stress levels are significantly worse. For example, and actually, let me put this out there too. Our staffing ratios haven't changed, meaning we have the same amount of staff as we did pre-COVID as we do now during COVID, and I'm sure they'll stay the same post-COVID. So can you imagine having the same ratios or getting the same amount of money, but now you're doing 10 times more work? To me, it just doesn't make any more sense. So now we're at the point where now employees are getting very crabby. They don't want to be here. People aren't getting taken care of like they should be because we're just getting completely burned out. And I hate to say that, but it's completely true. When the whole the whole Red for Ed was going on, when teachers were having problems, and I use that as a good reference tool because we're wondering, teachers were like, well, I don't want to do this anymore. But I know that's what they signed up for, that's what they signed up for as far as education. But we did not sign up for this. This is completely uncharted territories. We have yet to see an actual true pandemic in the entire U.S. for many, many years. So I know it's uncharted territories and nobody really has the right information or what exactly is the perfect thing to do, but whatever it is that we're doing, it's not working. It's completely true. Sorry if I rambled on or if it even made sense.
Yeah, because with what you're talking about, the stress, I know a lot of people, a big lot, especially nurses that have gone to doing jobs like giving shots, the COVID shot out, or doing something more or less stressful, especially in the ICU.
I'm going to start that next week, and that's just more like a mindless job for 8-12 hours I want, and I get paid a lot more money to do
a lot less, huh?
Way less. And I hate to say that, but this job, I don't love this job anymore. And I hate to say that because I love the people I work with. I work great with my staff members. I work great with other departments, especially you, Israel. I love all you guys over there, and you guys know I can always rely on you, and you guys, I love talking to you guys. You guys have become my friends. But the stress, it's you dread coming to work now, and it shouldn't be that way. Most of the times you're like, oh, okay, I'm gonna go to work today, no big deal, 12 hours, I could do anything for 12 hours. I don't want to do this anymore for 12 hours. It's not something I'm enjoying anymore.
So how do you deal with this stress?
Well, that's kind of hard because you just have to push through it. I mean, a lot of people have other outs when they go home, whether it's if they have a nice glass of wine or if they go to the gym. But unfortunately, I have a little kid and like a new baby, so I don't get that much free time.
And a puppy, a cute puppy.
And I do have a puppy. It was the dumbest idea I've ever had. I had a new baby and a puppy at the same time, and my 3-year-old's crazy. I don't know. My regular once a month pedicures, or whether it's to go to the damn grocery store for 30 minutes to get away. But honestly, normally at home I'm a happy person, but ever since COVID started, my home life has changed, and it makes it a little more stressful at home. And you know, sometimes your spouses, depending on if they're not in healthcare, which mine's not, they just don't understand what is going on.
Facts.
Why I'm so tired, why I'm always stressed, why I'm crabby. It sucks. It not just sucks for your work life, but it's also crappy for your home life. And just feel like if we were treated a little bit better, if we got paid a little bit more, if they brought us a little more staff, it wouldn't be like this. And people would be happier if their work life was better, because it's like a domino effect. If you're happy one place, you're going to be happy another place.
And then have you gotten your shot?
I have not. I don't know what the CDC recommendations are right now. I had COVID the 2 weeks before Christmas. So I don't even know if I'm allowed to get it right now. I know it was 90 days. I don't know if that has changed, but I'm probably not going to get it anyway.
Okay.
But that's just, okay. It's not do you need the reason why?
No, it's okay. And then if these future nurses out there who are like, I want to be a nurse in the ER, I want to be charged, I want to do what Brittany's doing, I want to do all that. Any advice, and honest advice?
I would say absolutely never. So when I started nursing, I started in the ER, and then I kind of floated around, did here and there and there, and I'm back to the ER, and I have been consistently for 6-7 years-ish, and I've been in charge full-time for a little over 3 years. And again, I love the people I work with, and wherever you choose to work, you'll probably love the people you work with. That's the reason why I've stayed being in charge. But I'm also good at my job too, so that makes me feel a little bit better. But I would say do not do it. You don't get it paid near enough. It's just not worth the stress. I would say go to dental school, which I should have done. You can make your own schedule. You get paid a heck of a lot more. And to me, that's a little bit better for home life. Working 12 hours when you actually working 13, 14 hours because drive time, and then you have to stay a little bit later.
My wife doesn't understand that.
Yeah, it's true. If you work 6 to 6, I leave at 5:30, and then I really don't get home until 7. That's a really long work day. It's not worth it.
Okay.
Don't do it.
Okay, thank you. Hey.
Hi,
What's your name?
Nikki,
What department do you work in?
the emergency department.
So during this time of COVID and before COVID, what's the difference that you've seen?
Brutally honest, we didn't hate work. Now we kind of do. It's rough every day, but our attitudes are pretty good, I think, despite the challenges that we're given every shift.
And what are those challenges?
Staffing, patient load, patient acuity, supplies. We learn something new every day. Everybody's potentially a COVID patient, so there's no possible way to have your PPE on all the time. Like somebody could come in for something normal, and then the next thing you know, they're COVID positive. So that's that.
Okay, and then how do you deal with the stress, and how do you guys, is everybody angrier together, or are you more coming together? Like, how is it?
It depends on the shift. Depends on how bad we're getting killed. Some shifts, depending on your crew, you have a more positive attitude. Some shifts are not so positive because it's just the people you work with. Generally in the emergency department, I think that we deal with 90% of our problems with, I want to say sick humor, but our humor is awkward because we have to be able to move on from somebody dying to a toe pain that checks in 5 minutes later. So our humor tends to be a little bit more off the wall, and that's kind of our coping mechanism.
And how do you not take it home?
You don't, or you do. I don't know. It depends on the case. I've been in this too long to actually take things home unless it's like a big deal.
Okay, let's say it is a big deal. So how do you do things to deal with it? Like to let out the stress, or?
I would probably drink.
Okay.
I don't know. I mean, I have to talk to my family, which they don't understand. I try to talk to my friends who aren't in medicine. They don't understand. So then you end up resorting back to people that are in this field, and then we all kind of have a crap talking session about it, and then we get over it, I guess.
Yeah. So if anybody wanted to do what you do, would you advise them at this time, or would you be like, honestly here, would you advise them that they should continue, or should they do something different?
We've all thought about leaving in the past year, all of us.
Me too.
100%. But I think the best way to describe anybody who's in the emergency department or what you do is, I think we're all kind of gluttons for punishment. We complain about our job, but deep down we love it, and we wouldn't know what else to do with ourselves if we didn't do it.
True.
So that's what we just like to complain about it, I guess.
Last questions. Have you got your COVID shot yet?
Nope.
Okay. Thank you.
You're welcome.
Hi.
Hi,
How are you doing? What's your name?
Kathleen.
And what do you do?
I'm an ICU COVID nurse.
So, what's the difference with being a nurse before the COVID and being a nurse now?
3 top things is knowing that you have to reverse gears and sometimes just make the person comfortable, treat the family too, foster grieving, foster dignified deaths. And the reason I start with that is because just things, I'm looking down because I'm not gonna cry. It's just one of those things. It's just, unfortunately, this go round, people seem like the people that finally make it into hospital, because we're pre-screening, we're doing a lot more, send you home if you're not on oxygen. It just seems like this round is people are just really sick and not gonna go home.
So are you saying that the second wave is worse than the first in your eyes?
And there's extraneous variables, and I think one of them is just that, there's only so many beds and we're getting the sickest of the sick too. So you gotta look at everything, but I'm just saying the difference of what we're dealing with now versus last year, and it's just a matter of just trying to still stay strong, still knowing that you're making a difference, still knowing that you just sometimes it's the comfort, sometimes you're trying to just be proactive and preventing complication as always, but it's hard to say. I don't want to babble on. It's just, but sometimes that you fight, but sometimes you got to let go and reverse gears, because you gotta hope for the best, but start preparing everybody for the worst.
So
Not
like,
to sound negative, but that's just where I'm at right now.
I need you to tell me how.
It's just
you
where we're
feel.
at right now, and you cry and you go home and you let it go, and we're talking to each other more. The second thing, COVID now, is you just get tired and you hear a bit less that you're a hero. You hear a little bit less that it's just the whole world is very unstable. So it's kind of like you go home, it's unstable. You come here, it's unstable. But the good thing about here is that we have a great team, and I think it's important that we verbalize, "Hi, I cried today," or "I feel like," whatever it is. And I think that's kind of the second thing, that the second wave, I think we're all learning to lean on each other even more and be human ourselves.
That's one
Say
thing.
it's okay to cry, it's okay to grieve, to get it out. It's healthy. Does that make sense? Like, when you have coworkers and you're just kind of like, you're just in the trenches together, and then now you're like, this is a war zone. Like, you know what I mean? And it's a bonding moment, and it's like when you go into work, you just start doing that gratitude list, because I got to hang on with what's good, because I can't control the outcome. I can only do the best that I can. And I think this next wave is just, we're all being human, and we're all just saying, I'm going to do the best I can and accept that, you know, it may be a long time for the treatment, and have hope that this vaccine will help.
How do you deal with it at home, and how do you deal on not lashing out at people? Because
how to cope.
Yeah, how do you cope with it?
Okay. Well, here's the thing. The sooner you accept the situation, the better. The sooner you realize things may not change, you're going to just do the best you can, and this is where it is. Spirituality is big. I pray.
Okay.
I was just having a talk with my mother, because she's moving out of state. But my point is, I said, you know, I'm ready to go, because I'm in the trenches with maybe new strains. You know, who knows? I'm getting the vaccine. Who knows? You know, I could step off a curb and die. But I had like that conversation of just having that peace and faith that no matter what happens, if I get sick or family gets sick or my mother goes, it's just a matter of letting go and just know that you gotta have some kind of spirituality. I don't care if you hike. I don't care if you pray to a tree. I don't care if you pray to God, Jesus, whomever. You gotta hold on to the faith that this is just, I'm here to serve a purpose. I don't think my purpose is done. And then each day I just try to make it better. Does that make sense? I also go to counseling. Don't be shy. I go to counseling and I talk, you know, to someone who can give me encouragement.
Now, what would you say if somebody asked you they want to come into this kind of work?
Oh, well, here's the thing. Right now it's tough. Right now it's a war zone. I think it's a calling. I was in business before this. This is my second bachelor's, and I'm 15 and a half years a ICU nurse. It's the hardest job I ever loved. Just get a mentor, just actually find out a few people what it really is, because you hear always the bad things, but another person's like happiness in heaven is another person's hell. So my point is that just don't lose hope. And the thing is, I can die tomorrow and I know I made a difference in so many people's lives, and that's powerful. Does that make sense?
Yeah.
I didn't negotiate handbags anymore for Bloomingdale's in Manhattan. I'm negotiating real stuff that really matters. Just like my one patient just now, I love her to death. But today I turn things around. Again, coping. It's putting on rose-colored glasses and it's not easy, but you just have to sometimes just have that gratitude list. Go through, what am I grateful for? What could be worse? I'm not in the bed. You know, I'm not the one sick. I still have a lot left in me. You lean on people. You go out as much as you can. I go bowling.
Hey,
it was like the first thing open. I'm like, I'm gonna bowl.
I always tell the people on my YouTube, KISS method, keep it simple, stupid.
Yes.
The most simplest stuff is what really.
And that's just it. Life goes on. You know, you take calculated risks for me, and I go out. You know,
Well,
sorry, but I digress because I'm tired. One of the things is that too, it's just sometimes just holding somebody's hand, and sometimes just, I know I made a difference in 25. Like, I know I was able to redirect her focus. For example, her daughter was upset. She started crying. I said, no. I said, you have a chance to, no matter what happens, you're not done yet. We don't know. But I said, you know what? Right now you can FaceTime your daughter and spend that time that some people don't have. And she stopped crying, and you know, and that was like, I came out of there, I'm like, you know, so I wouldn't give up hope being a nurse, because look at all the things that you could affect and just do such good.
Thank you.
Yeah.
I appreciate you. Hi.
Hi,
What's your name?
Mackenzie.
What department do you work?
I work critical care, ICU.
Okay, so what have you noticed what have you noticed before and now during COVID at this time with what you do?
There's been tremendous changes. The biggest change that I've noticed is the patients that we see are substantially sicker, and the volume has increased tremendously. We see people that are here longer. They have a lot more illness, and the other struggle we're seeing is that people who are having normal chronic health problems we're having a hard time fitting them in because the system is just so overloaded. before COVID, you could have a good day or a bad day, and on your, you have bad days and everybody kind of lifts each other up. But over the course of the last few months during COVID, we've had so many bad days that everybody's kind of exhausted, and almost every day tends to be a bad day.
So how do you push yourself to coming in and helping, because we're all human,
We are all human, and it is really hard, and I try to make sure I take my days off when I can, and when I'm feeling super negative, I will lean on some words that help me keep my perspective. I had one co-worker of mine who might be sitting over here give me some really awesome perspective one day when I was really struggling to maintain a good attitude. And she said, be thankful to be upright, to be able to be here, because these people are so sick and they just need our help. Not everyone can deliver this kind of help, and so we need to be here to play our role to do it, and it won't be forever. So for today, be thankful, do the work. Tomorrow's a new day.
And then how do you deal with the deaths of people, and sometimes seeing other people who come in here not knowing that this might be the last time they see their family and things like that?
Sure. So a lot of people, once they get to the point they need our care, especially to be on a ventilator, don't get to go home again. And the way that I've been able to cope with that in my own heart is to just take care of them the best that I can while they're here, and honor them in the way that I do the small things, like shave a face, or give a bath, or make sure everything's clean, and just try to do all the little things. And if someone does pass away, post-mortem care and things, like honoring them and making sure it's done correctly and done with kindness.
So do you have any advice for all the want-to-be nurses in the future, or who want to be in the ICU and might be in this position one day, and they're scared, like, I don't want to deal with all that?
Future nurses, I tell them to buckle up, because they're coming into a work field that is unlike anything we've ever seen before. We're hoping it's not going to last forever, but you're smart, you've learned a lot, you've done a lot. Now you have to apply it, and you didn't get the full school experience like you had planned. You're not going to get the full orientation experience like you planned, but be resilient, stand on your truths, and lean on your coworkers. People have a lot to share. They're ready for your help and ready to share with you. So find the old cranky nurses and buddy up with them so you can learn a lot. I had a mentor named Linda, and I learned everything I possibly could from her. Legend. She was a legend.
I thank you very much for your time. Hi.
Hey.
How are you doing?
I'm doing okay.
What's your name?
Sarah.
And what do you do?
I'm an ICU nurse.
So we've been asking a couple of people, trying to get a story of how or what do you see difference between pre-COVID and post-COVID, and anything, like, what's your experience? How do you deal with the stress? How's the workload? What do you see? You know what I mean? And how do you cope with it?
That's a lot of questions.
I know.
All right. So pre-COVID, I feel like I've always wanted to be in healthcare. I've been doing it for 16 years now, essentially. I started off as a nursing assistant and worked my way up to being a nurse. And you'd have, you come in, you do your job, you take care of your patients, you go home, and you just did your job, But then after now, at the beginning of the pandemic, and even now in the second surge, the job feels heavier. It feels, before it was, people would kind of off the cuff go, oh, you're gonna go save lives, and you'd, oh, you're a healer, and you just kind of went, okay, thanks, and now with this, it's heavier. You come in and it really is sometimes like life or death for some people, and it, you come in and you think, is this person gonna make it? Before we'd intubate somebody and you go, okay, you'll be on the vent for maybe, a couple of days, we'll get you extubated and send you home and you'll be back to your grandkids. Now we intubate, and beforehand we're cognizant of, have they spoken to their family right now? Have we taken that 10 minutes to get them to speak to their family? Because we don't know if they're going to speak to them again after.
Yeah.
And it's every time we intubate now, there's this worry of, will they even come off? Is this the end? And it's heavier. While we might be in some ways saving more lives, sometimes it feels like we're losing more too, and it's heavier. As far as coping, the coping is hard because it's, everybody's different. Some people can go out and exercise and, do, create art or make a blog or a lifestyle blog, or do anything else. But, some people, go within themselves and have to have quiet time. And it's hard to have quiet time, when your whole family is working from home and
True.
You've got your kids that, maybe can't go to school. So you can't kind of close up and be quiet now. So you have to think of different ways to cope. And, sometimes that coping looks like, turning your phone off and just not hearing about what's going on today, or, going just to the grocery store.
Yeah, because that's what I deal with some of this is like, people tend to ask us like, how I have this symptoms, I have that symptom, do I have COVID? Oh, how's this COVID? And they never actually say, hey, Sarah, how are you doing?
Yeah.
You know what I mean? Like, they don't ask you, how are you doing? It's more of, let me get information, because people are scared. But it's like, this is why I did this, because I want people to understand and see what we go through here. Because like what you said, when I come in sometimes, I feel it. Like you automatic as you walk through that door, it's like there's an energy of like just heaviness, and you know what I mean? So I'm just like, but now, did you take the shot?
I did.
How did it make you feel how was your experience with that?
First of all, let me tell you, I'm pregnant. So I know a lot of people were back and forth, you shouldn't get it, you're pregnant, you shouldn't get it. And then some people were like, you should get it because you're pregnant, and it went back and forth. So my decision wasn't an easy one to make. It wasn't just, I went and said, I'm going to get the shot because I'm not afraid of anything. It took a lot of time, and I had to really think about it, pray about it, talk to my husband, talk to my OB. I wrangled the infectious disease doctors here and said, what do you think?
Yeah.
I got voices from everywhere, medical, professional, spiritual, friend, everybody, colleagues, and said, what should I do? Because it's not easy, so if someone's telling you, go and get it, and if you don't get it, you're an idiot, it's not as easy as that. It wasn't as easy as that for me. But what it came down to is, I've seen what COVID looks like. I've seen it.
True.
I have seen the end stages of COVID. I have seen what it looks like when these people have run their race and they're exhausted, and just the unknown and the fear of that. And I've seen what vaccines do. And typically with vaccines, you're not likely to have, many symptoms. They've been, looking and researching this type of vaccine for, since I think it was 2002, they started in the research and development. They just couldn't get very far because they didn't have the funding. So they've been slowly researching over time, which gave me some peace in that. And thankfully I got the shot, not a symptom to be told, except for tiredness, which I can't, blame all on the shot.
Did you get the one shot, or did you get the one that's a 2 series?
It's a 2 series. I got the first one. I'm waiting to get the second one because it's not my turn yet. So I have to wait until my, 21 days.
So if any future nurses that want to do what you do, and they might see this, and not just future nurses, I mean even students who are now graduating and they have to apply, and they're like, but if I apply, there's a chance that I might just go into it, and like what you said, people are scared. Do you have any advice for that?
It is scary. I think that's probably the thing that's you need to encounter and understand, is that you might be scared and that you might be unsure. But my niece is going to school. She wants to go to med school, and she's graduating high school and going straight into med school. And I asked her, I said,
congratulations.
Yeah, she's really smart. And I asked her, I said, with all of this that you've seen, and she's just almost 18. And I said, with all of this that you've seen, and I've told you and everything else, does any of it deter you from wanting to get in, dive into this? And she said, if anything, it made her want to do it more.
Yes.
Because if you have a hand to help, you can do it. And if you have the mind and the spirit to do it, you're going to do it. And I think that's what it kind of boils down to, is that, you know, yeah, the job got heavier, but we've all been picking up the pieces as much as we can, you know, together. And that's all you can do.
Well, thank you, Miss Sarah.
You're welcome.
Hi,
Hi,
what's your name?
Sharon.
Sharon, what department do you work in?
I work in CVICU, and basically, like what you've asked, what is the difference before this pandemic happened? We had more.
Hold on, what's CVICU? Explain that.
Cardiovascular ICU.
So you deal with heart patients, right? Who
Yes.
come out of heart surgery?
Yes.
Okay.
So the difference is that we have more patients because we have more patients who's having surgery. Then the pandemic happened, so we're not getting as many cases because of the, you know, like we're trying to curb off infection, so we're only getting the emergent ones.
Okay. And then what, besides the heart, what do you see in the workload? Are you more scared, less scared, stressed? And if you are, how do you deal with it?
The workload, obviously, during the pandemic is actually heavier.
Okay.
And the downside also is that before, in terms of rehab, we're able to do more for the patient. Like example, we allow them to walk the whole of the unit, but now because of the COVID, we just kind of like situate on a certain distance only, and this obviously is an issue.
Okay.
So, because you wouldn't know how breathless they get after this certain distance, but you know, yes, we can go back and forth, but.
So that's also used, right, to determine if a patient is ready to leave, right? Because as you walk hard work, and you guys monitor the oxygen and things like that,
Yes.
right? Okay. So have you gotten your shot yet?
No, because I was unwell.
Oh, you was on. Are you planning on getting your shot?
Yes.
Okay. And then for anybody who's trying to do, you know, cardiac nursing like you do and get the experience, or even for those who are graduated and those before who are not graduated, who are during school, because I know there's a couple of people who are like, I want to go start working, but I'm scared. And then there are people who are like, oh, I wonder how it's like. And this is why we made this video. What do you recommend, and do you suggest that they get into nursing?
I would suggest they do it. Obviously, the first time you work, regardless of where you work, whether in cardiovascular ICU or ICU, the first day is always scary, like in any situation.
Yes.
But what I would suggest is you persevere. You will meet all sorts of people, so I would suggest on the day before when you start working, you have to grow an extra layer of skin.
Okay, but doesn't that come with time and experience?
True, but then, you know, when you're new, you sometimes are a bit more sensitive, you know, and sometimes there are certain things that you need to let go, because these things will not change over a quick period of time. It's a long haul, and then, you know, with experience, you gain the wisdom of which battle to pick.
Okay. And then so with all the stress and heavy load, what do you do? Do you leave it here? Or even the part not about leaving it here, of course, because everybody's been telling me that. But the real question is, like, what do you do at home to release and get this away?
I think before you start working as a nurse, you should find a hobby, so that when you go home, you're able to unload regardless of whether there's a pandemic or not. Obviously, with the pandemic, it's a bit restricted. Like example, if you're used to going to movies or what, obviously it's restricted. But you have to learn these. That's why you need that extra layer of skin.
Okay.
You need to learn to cope, unfortunately.
Okay. That's the magic word, cope. You hear that, people? A lot of people don't know about that. But thank you for your time, and we appreciate it.
Okay.
Hi.
Hi, my name is Dr. Tiwari. I'm one of the healthcare workers. I'm a physician. I work in a hospital, and I've been dealing lately with COVID patients. As you all know, this whole 2020 has been a lot of COVID coronavirus patients. And just to let this word out for the general public, that there has been a lot of stress in the healthcare workers as we deal with the patients, patient load, the amount of work, amount of patients coming in. I do understand in New York it was more so where the patients were there earlier in the year in 2020. But as we have seen, by the end of the year, nearly all states have gotten a lot of patients. Arizona recently has been having a lot of COVID patients. I do recommend the people getting vaccinated no matter what, because not only are you going to save yourself, but you are, the most important part is you're going to save your family members, your elderly grandmother, your grandfathers, people who you come in contact with who may have multiple other diseases and may not be able to withhold and all have immunity against the coronavirus. So, to avoid the hospitalizations, to avoid so much of workload, we have to do what we can do the best for ourselves as well as for the community. So it is not more about us, it's also about the community. We want to create a herd immunity. So to have a herd immunity where everybody has the antibodies against this virus, we have to do our part. So it is important, and I would suggest that you should start it from home itself. So home is where we all meet together, our parents, our grandparents, our children. Even though we haven't seen young people having a lot of disease process where they require hospitalization, but I think things start from there. Your young people, they go out and they party, they come back, and then they give the disease to their family members. So we all have a role to play. Regarding healthcare workers, I would like to say this, that yes, we have faced a lot of stress, a lot of workload. We have had issues getting adequate masks and PPEs. So, but we are fairly comfortable at this time dealing with the patients. But still, there's a lot of stress, and nobody talks about stress in the healthcare workers. We have been facing post-traumatic stress disorders. A lot of the nurses, a lot of the nursing aides, respiratory therapists, all the other healthcare workers besides physicians have been affected by the disease. A lot of them have been sick.
How do you deal with it outside of work? How do you, with everything you see here, how do you leave it at the door? Do you take it home? Do you see a therapist? Do you go hiking? What do you do personally to deal with it?
That's an excellent question. Personally, me, I do try to deal it I'm a very spiritual person. I try to deal it in that way. I do try to hike, try to maintain my activity level. And besides that, I think it is more so also talking to each other, talking to our families, getting to, be that one unit so we can discuss each other's problems. So, I would suggest people not be all alone, though because of the separation, the distancing, the mask use, we tend to become individualized, but we are not individualized people. We are social animals. We are a unit, a team of people. So I think talking to the family members, discussing your issues, telling them that you're stressed out, that helps. Certainly, I don't think I need a psychiatrist at this point. But yes, I think stress is a very big issue which we have all been dealing. And I think not only healthcare workers, other people who are in this world right now who have not even had COVID are also dealing with the stresses which are related not only about the disease, but about people getting segregated, being alone by themselves, not able to do their things, not able to go out and exercise. So, go out and meet other people. That's a part of, this human spirit, our humanity, where we meet each other, talk to each other. So that has become, in a way, that has been affected. But I think the main part over here, what I'm trying to say is that it is difficult to deal with stress, and we all are dealing with, but we have to do certain things. Make sure that we exercise, make sure we do some activity levels, eat healthy, do our part in the community, try to see if we can help other people in some ways. There are many ways that we can help, even if we cannot be close to other people. So that is my intake on this. Do you have any other questions before I leave?
What would you give advice to somebody who's trying to do what you're doing?
What I'm doing, well, I'm a physician, but I have had lots of nurses, lots of respiratory therapists, other healthcare people, working very, very hard. I would say to keep our sanity alive, to be de-stressed about it. I think talking to each other, over the phone, whether it is over Zoom, over FaceTime, however it may be. Talking helps definitely. Discussing our own problems helps definitely. Doing some activity helps. Reading, if somebody likes to read. Trying to see what you can do to enhance your own spirituality. Maybe meditating.
What
maybe
about
painting?
Oh.
Whatever somebody feels that they can do an activity to de-stress themselves certainly is recommended.
What about kids or adults, young adults who are future doctors? Do you have anything to say to them who are nervous?
I think I more than welcome future doctors, more the better. And I have seen a lot of people are now coming in and deciding to be doctors, and a lot of the medical colleges have taken new people, and people are getting more quickly authorized to be physicians. So that is very nice. This is a great field where you can help other person, and compassion is there in this field. You can feel fulfilled being a physician. Money is not bad either. This is a very stable job, and the profession goes long until death. So I think there is room for all of us to work on it, and I would suggest people who want to be doctors, so please, you're more than welcome, and thank you for offering your services to us, and it would be appreciated if we would have more physicians in this world, or nurses. Thank you so much.
Thank you very much. Hi,
Hi,
what's your name?
Bailey.
What do you do?
I'm a charge nurse here on the tele floor.
So I've been asking everybody the same question. Since before COVID to now having COVID, what have you seen? And it's a broad question. That means just throwing everything you want to throw in at one time.
Okay, so biggest thing, definitely more patient loads. There's always people waiting for beds in the ER. It seems like everyone's sicker as well, because a lot of people don't want to come to the hospital right now. They're scared of getting COVID. So we've just seen a lot of that. Short-staffed as well. The whole country's short on nurses, so we're not getting as many travelers as we usually do. People are getting burnt out, or nurses are out sick with COVID. So we've definitely been more strained. Our ratios have been higher, and just everyone's kind of feeling burnt out.
Yeah, so with the burnt out and stressed out, how do you deal with it as a leader to get everybody calm in this kind of situation?
So I try to be as positive as I can. And sometimes what I do is I like to bring pizza or donuts or snacks, just something to kind of raise people's spirits as much as I can.
And when you're not here, how do you deal with it outside of work?
Sleeping.
Sleeping?
I sleep a lot.
Okay, okay.
I don't know, I've been really tired, so I think, just hanging out with friends and catching up on sleep is huge.
And then what's this? Did you take a shot?
I got my first one. I get my second one on Monday.
So how did you feel when you got your shot?
The first one was fine. It really hurt my arm. Other than that, though, I didn't have any symptoms. It was like getting the flu shot.
Damn, being young and all that, huh?
I think it helped, yeah.
So since you're such a young charge, do you have any advice for any future nurses who want to do this?
I'd probably recommend not doing it. No, I'm kidding. It's a hard stress load. So I think you just have to be ready to roll with the punches. But if you set your mind to something and you see an opportunity, go grab it. Not everyone wants to be a charge. So if you have that desire, you can do it.
Thank you. Hey.
Hey,
What's your name?
Francis.
And what do you do?
PCA on PCU.
Okay, so now people want to know out there what's going on with the COVID and all stuff like that. And our question is, what do you see from before COVID and now during COVID and PCU? How is it, the workload? If you go home and, release, what do you do to release and things like that? What are you seeing?
The floor is extra heavy, more than usual, and it's flu season, so it's normally heavy at this time of the year. But right now it's over capacity, and the workers are overwhelmed and tired, and we're just trying to get through the shifts as best as we can. So what do I do when I get home? Just not think about work but on my days off. So
What is it that you're doing not thinking about work?
I don't know, just
Okay.
I don't know.
Okay. And then what's this? How is it like do you guys help each other a lot, or is it more now like everybody is just so busy that you guys don't even see each other? How is it?
We try to help each other as much as we can, possibly can. But yeah, there is like sometimes it's hard to get help when you need help with an extra patient.
And so do you get more patients because your floor is not COVID? And because usually there was 2 floors that
No,
were
we're
not.
just short because
Correct.
sometimes people are out sick. 'Cause, you know, even like staff is getting sick. So
Okay. Okay. Have you ever got sick?
I haven't. No.
Oh, good for you.
Yeah,
Did you take the shot?
I did not.
Oh, okay. Are you planning to take the shot?
Not right now. No.
Okay. And then if somebody wants to do what you do, any advice for them?
I don't know. Really think about it because it's heavy. It's hard work.
Okay. Thank you.
You're welcome.
Hey,
Hi,
what's your name?
Sarah,
So what department do you work in?
MedSearch.
So since the question we're asking is, since COVID started, what's the difference pre-COVID and now that COVID's going on? And you could talk about anything, your experience, workflow, how do you deal with it at home? Are you carrying more patients? Are you scared to get in the room? You know, like even the PPE, all that.
We're gonna decline that. So pre-COVID, it was busy, but you know we were always a really good team, and now I think we're even better. Let me call you right back. Now I think we have, even a closer knit nursing group. You know, the patients are much sicker than they were. You know, I don't really do anything at home. I just come here, I work, and you know, just one foot in front of the other.
Okay, so as you're in charge, right?
Yes.
You deal with setting people's assignments and who. So like, do you see more frustration? Is there more people arguing? Is it less people picking up, or is there more people picking up?
I think with our floor, we have about the same amount of people picking up. There are frustrations, yes. I don't know that there were arguments, but feelings are definitely heightened.
And are you, since now it's been a while since it's been on, when it first started, were you scared going in rooms and touching patients to now are you more comfortable, or is it still the same kind of fear?
I don't know if I ever really had a fear.
Okay.
It was their patients, they're sick, and we use what we have to protect ourselves and other patients, but I don't know, I just walk into the room and get it done.
And have you taken the shot?
No, I have not.
Okay. Are you planning to?
I don't know yet.
Okay. And then for any nurses who are coming up, students who want to be nurses, or new grads who already graduated, let's start with the new grads. Any new grads who already graduated and they're like, oh man, when I apply, I'm gonna go straight into COVID. Like, what advice would you have for them?
It's hard. It's difficult. It's, you know, still rewarding.
In what way is it rewarding to you?
You still get to help, you know, people feel better and you know, get the care that they need and all of that, but harder in the sense that quite a few of your patients end up down in ICU, or they code here on the floor. That part's hard, and that's happening a lot more.
Yeah.
But I'm more of a focus on the good kind of person.
Okay. And then, so what about the people who want to be nurses? Do you still encourage it?
Absolutely. We need them. They just need to know that it's gonna be hard work. But if it's your passion and what you want to do, then hey, come on. We got room.
Thank you. Okay, fellas, introduce yourself.
Gary Kavner.
And you are?
Dan.
And what do you guys do?
Respiratory therapist.
So how long have you been doing respiratory, Gary?
30 years.
30 years. And you, Dan?
22.
What's the difference right now between what you've been doing before and how has COVID changed the respiratory field? Go.
I mean, it's the same. We have a lot of sick people from COVID. We PPE. We do the ventilators. We do all the stuff that goes along with COVID.
Can you get into more detail, sir? What's changed?
What's changed? People are in isolation. People don't have visitors. They're really sick. They're on ventilators a lot. They're a higher acuity. They're really critical.
Yeah. And what's this? When they come, when you say people don't see them, so are you saying that most people don't even know that they're saying goodbye to your family at that moment when they drop them off, or when they just come in here?
That happens a lot. The people are coming to the hospital. They're sick, and as they're here, they progressively get sicker, and sometimes they get to the point where they don't get to say goodbye to their families. They're here and they pass on, and the families don't get to say goodbye. They just...
Yeah, it seems like they bring them to the hospital expecting them to get well, but they don't get well.
And how do you deal with it? I mean, I know we see people pass all the time, but now it's at a higher rate. And you know what I'm saying? And sometimes you see the family come here, and like one time I saw them play music. How do you deal with it as a person, seeing all that?
You can't take it on a personal level. You just do your job, and
take with the good and the bad.
What happens, happens, and you just can't let it affect you. If you
have
do,
to.
you're not going to be right.
Do you do things at home, maybe, like to relieve the stress? Or, you know what I mean?
Hang out with the kids.
Yeah, spend time with the
Okay.
family and the kids and appreciate what we have while we've got it.
Okay. And guys, this guys here are dedicated. How many days were you working, tell them, because of COVID?
He worked 35 straight. I worked 32 straight.
You know what I'm saying? It's crazy. It's crazy. And like, do you ever feel like it's enough?
What do you mean by enough?
Like, do you feel like, how can I say it?
Working the days?
Or no,
what
like,
we
do you think with what we do, is there more we can do to try to stop this?
It depends, because, I mean, it seems like the only thing that's helping them is ECMO right now. And
Okay.
ECMO, there's only a couple places in the valley that does it, and they're backlogged. So we're doing the best we can with what we have.
Yeah, and then tell them about how they doubling the rooms, and even at that one point when I was in California, you guys were using 2 people in one vent. How was that like?
Well, I've never used the 2 people
No.
in one vent, but we're doubling rooms. The ICU has double rooms. The rooms up on floor, they're designed for 1 person, 1 bed. Private rooms are being used with 2. We have 20 ventilators running most of the time in the ICU. It's very busy.
Do you ever see it slowing down?
Not
No.
within the next 6 months.
No.
Okay. Well, thank you.
No, thank you.
Hi,
Hi, how are you?
I'm good. How are you?
Doing great.
And you are?
I'm Melissa Allen, and I'm a respiratory therapist.
In what department do you specialize in?
I specialize in pediatrics and especially the neonatal intensive care unit. The neonatal intensive care unit is premature babies that are born before 38 to 40 weeks, which is the traditional pregnancy. So they're just premature. They're born early for some reason or another.
Okay, so this is just interview more of what has changed from before COVID to COVID now that you've noticed in the NICU.
In the NICU, we've changed a lot just in the fact that we've never really been super protective in wearing masks and all of that sort of thing around babies, because babies usually, the neonatal intensive care unit is a clean environment. We wash our hands very carefully. We are always as sterile as possible. Even in regular times, we wear hats like this to protect our hair from getting all over the babies and all over the unit. We go to the OR a lot for C-sections, cesarean sections. And since COVID, we just have to wear a lot more protective equipment. We wear N95 masks for deliveries because the moms are breathing deeply, and these are adults and they could have COVID. We've seen a lot of moms with COVID here and at other Valley hospitals. Luckily, the babies have not been affected so much, but the moms really have been. And so sometimes we have to care for the babies just because they can't be with mom.
And do you see any moms or even kids with COVID?
We have not seen a lot of that here. There have been isolated cases in some other hospitals, and there have been like teenagers that have had very severe cases, including and up to cannulation and being placed on ECMO, which is extracorporeal membrane oxygenation, which is the most life support we have here on Earth. And unfortunately, every facility can't do that because it's so rare and specialized.
So with the other cases that you've heard, is it if when mom has COVID, do you still deliver the baby?
Absolutely, absolutely. And then there have been cases as severe as intubated mothers in the ICU on ventilators. So the mom's sedated on a ventilator, and then they deliver the baby.
And then does the baby then have COVID too?
No,
or?
It is not a bloodborne pathogen. It is completely aerosol only. So it does not go through the placenta to the baby.
And then, so have any babies had COVID?
A couple babies have tested positive throughout the country. I try to keep up on this sort of thing. However, there have not been any symptomatic or sick neonatal babies with COVID. So they have tested positive, yes. But
And
that's
then-
usually after they've spent time with mom, because this disease transmits through aerosols and breathing. So if mom's holding a baby close, mom can give the baby COVID.
How do you deal with a lot of this stuff that you see now?
Because I'm not only in the neonatal environment, I also help out in the adult ICU. I have just decided that I'm going to eliminate any and all additional stress in my life. Social media has been crazy lately. There's been a lot of people, they're up and down on whether or not they want the vaccine. There've been people up and down on politics, as everybody in the world knows. And I just try to block all that out. And I watch dog videos. And I kidding, not kidding. It's like I've eliminated my Instagram. I think I have some makeup tutorials and occasional food items on there. But other than that, I try to keep it very upbeat and light. I do not watch any news. I try to do things that make me happy. You have to have some balance because it is such a dark, dark time where we are seeing so much agony and so much death. And it's very dehumanizing. I find that the way to do it is to have balance. And when you're off, to truly be off and focus on something else.
And then what advice would you have for anybody who's trying to get in the medical field right now and do what you're doing?
I think the medical field is still a great place, and I think we are heroes. We've always been heroes, and even more so now. And people should still come into the medical field. They shouldn't be dismayed by what we're seeing now. This is going to be a once-in-a-lifetime kind of pandemic, and it's going to last a little while longer. But we need new students. We need people to enter the field.
Thank you very much.
You're welcome.
You have a good day. Hi.
Hi,
What's your name?
Jamie.
And what do you do?
I'm the lead for the respiratory therapy department.
So the question we have in here is what as a lead, because we've already talked to other respiratory, but as a boss, what have you seen that's different from before COVID and now during COVID, and how do you deal with it? What do you see? Do you take it home? You know, anything interesting we could know.
What do I see? It's just really busy. All of our life support machines are taken. Staff is stressed out. Our workload has tripled. Staff is picking up because our bonuses, they finally made it to what the nurses' bonus is. Staffing is hard.
So, like, what do you mean it's hard? Get into details a little bit.
Well, people are scared to get COVID and they don't want to work. They're tired. They're burnt out.
How do you motivate them to come in?
Money.
And so you said some of the equipment, there's not enough life support equipment. So what do you have to do if there's not enough? Do you call other companies? What do you do?
So I called all the other companies, but they're all taken. They're all spoken for. So thank God for Trump. He gave us 11 of the Zolvins, and that's what we're resorting to now.
Okay, okay. And so, do you deal with any, because I come in here and complain sometimes. Do you deal with more complaint, less complaints?
More.
Yeah, and how do you pick and choose what to take seriously? Because, you deal with so much and you don't want stress. How do you deal with that?
So you have to take everything seriously, but you just try to find a solution for staff's complaints or their concerns.
And how do you deal with it at home? Like, do you take it home?
No, I leave it at the door when I clock out.
Okay. So you don't go home. What do you do just to let loose? Because no one's going out. Everything's shut down.
We go to our cabin and go hunting.
Look at you. Okay. So for any future respiratory therapists, so people who haven't even been to respiratory, or people right now going through respiratory who say, one day I want to be in charge of department, deal with staffing and all this stuff. Do you have any advice for them? And do you recommend to do respiratory, or are you more like, nah, do something else?
No, respiratory, I would never change it for the world. I've been doing it 21 years and I love it. You have to be strong and you have to be committed and you have to be goal driven. I say go for it.
Okay. And have you gotten a shot?
No.
Okay. Are you going to get it?
I am going to wait a little bit to see some outcomes of.
Okay. Thank you for your time.
Thank you.
Hey,
what's up, man?
how you doing?
Chilling. Just got here.
What's your name?
Damien.
And what department do you work in?
EVS.
So what have you seen with any changes with your job before COVID and now during COVID?
Before COVID, it wasn't that bad. It was always going here and there and how stressful it is with dealing with having to do the type of work that we're in and stuff like that. But since COVID came along, it toppled over times 10. So it didn't really got bad after COVID.
How you been?
All right. So after COVID, then really got really stressful and dealing with all this stuff, and then having people that don't believe that it's real, and having people that just don't give a care and shit like that, and then you see people passing away from this, and it's kind of hard.
So what's this, since part of the COVID thing is cleaning, how's the cleaning going? Like cleaning extra, do you use special cleaners? Do you still clean the same? What's the difference?
Well, it's not really that much of a difference. We're doing more of it. We gotta gown up more, gotta constantly go in and out of these rooms to clean them, and the cleaning process takes a lot longer, and it's a lot more tedious that we have to do. So we can't miss a step when we go in these rooms to clean them.
And is it, okay, so like in the ER, I was talking to one doctor, he said that there's less patients, but more to do. So do you see more rooms to clean, or is it less rooms, but more details? Like, I'm just guessing, so what?
No, it's kind of a catch-22. It's like, you could have less patients, but you'll have more rooms to clean because say a patient doesn't have COVID, but they get tested. So you have to treat them as if they have COVID right off the bat, because that's like a possible. So until they come back negative for COVID, you still got to clean that room like it's a COVID, unless they told you before you went to clean that room that it's negative for COVID, and you can clean it as normal.
Okay. So with all the stress, how do you deal with it at home, or what do you do? Do you go running? What do you do?
Well, lately I've been going back to doing my poetry and stuff like that. But other than that, I just sit down, chill, play games, or just relax and go to sleep.
Okay. What kind of poetry you do?
Deep soul poetry.
Okay. So if anybody wanted to do your job or anything, what advice would you give them?
And just know that when you come in here, it's going to be a little tough times here and there, but at the same time, if you learn how to do it and get good with it, things will work out in itself.
Okay, thank you.
All right.
Hi.
Hi,
What's your name?
Reina,
And where do you work?
in the cafeteria.
So, what have you seen the difference in the cafeteria before COVID and now that there's COVID?
a lot because when not COVID, there's a lot of people coming in, and now so slow.
It's so slow. What's the big changes you've seen? Like hour-wise, what time are you open all day?
No, it's different hours. It's closed, you know.
And then I noticed you guys don't let even people choose what they want because you used to have the salad bar open, right?
It's not. It's all about it's closed
Is it because you're trying to prevent infection?
for prevent infection. Yes.
Oh, okay.
Because it's contact.
Oh, okay, okay. So, how do you deal with the stress of all this when you're not here at home? Like, what do you do?
In my home,
Yeah.
it's the same. You know, clean and disinfected. Mask, using mask.
Okay.
And my family is not coming because you know the COVID is terrible.
Oh, okay, okay. Now, do you find it harder now or easier than before, like working?
It's more hard.
It's harder?
Yes.
Are you afraid because you work with hospital people? Because you've had COVID before, right?
Yep.
And how did that feel?
I feel good now, but I'm scared get again. You know.
Oh, okay. That's understandable. And did you get your shot?
Yes.
When you got it, how did it feel?
Good. I don't feel nothing.
No after effects or nothing?
No.
Okay. So if you had to recommend this for somebody who's trying to do anything, would you recommend it or no?
I'm recommending.
Yeah?
Mm-hmm.
Okay.
Yes.
Okay. Thank you for your time.
You're welcome.
Hey,
What's up?
what's your name?
Keith.
And what do you do?
I'm a pharmacy tech.
So the question here is, what have you seen in pharmacy that's changed pre-COVID to now during COVID?
Biggest thing has to be just the IV prep. Obviously, there's so many people on remdesivir. We got another med, Actemra, and then now they're using another one called BAM. And so basically, the remdesivir is a big, heavy hitter. There's a lot of people on it. It's probably the biggest change is takes so much time, multiple personnel to prep those. We're having to pre-make them because there were just so many people using them. And now we're pre-making them, and then they're just being delivered, throughout the whole day. If they're not being made, they're being delivered. And so that's probably the biggest thing, is just the difference in the medication, IV prep for those types of people.
And what about workflow orders, even just co-workers? Do you have to deal with what other departments are dealing with?
I would say as far as workflow, it's actually required a lot more staff, just because you have your normal patient workload on top of all of the COVID people, which is all of ICU pretty much, minus the cardiac ICU. And then, all the third floor pretty much is a lot of COVID up there. So that requires, we're just going through medication like crazy. We've had to increase the PAR levels and all the Omnicells with multiple medications, just because there's anyone that's on a COVID regimen just goes through a certain amount of meds, certain types of meds. So.
And then how do you deal with the stress? Do you take it home? Do you walk? What do you do to deal with what we're going through right now?
Stress-wise, it's difficult because it's like you don't have time to deal with it, because it's just, I work a 12-hour shift, and so as soon as I get in that door, I'll just tell another nurse, as soon as I get in that door, it's just, you're hitting the ground running. And if it's not labels pouring off the printer, it's phone calls, it's nurses calling, they need assistance with different things. It's a lot of little things that add up. You don't have time to deal with all that kind of stress until you actually get in your vehicle and you're going home.
And then, are you vaccinated?
I got my first shot. I'm getting my second one.
How do you feel? How does your body feel? How do you feel?
I feel good. I haven't noticed anything in particular, but I don't know. I just got it last Friday, so it could be.
And then for any dudes or students, whatever you want to call it, who want to be pharmacists in the future, do you have any advice, any recommendation?
As far as that goes, definitely any advice I would say, I'd have to say that you'd have to definitely be ready to hit the ground running. And hopefully you get some decent training. That's a huge part of it. It definitely helps. because we've seen both ends of that, where someone comes in, doesn't get the training, and it just doesn't work out, or if we have the time to spend with someone, which is a whole other issue, to train them correctly, it definitely, you can see a difference in those types of people.
Okay, thank you for your time.
Yeah.
Hey.
Hey, how's it going?
I'm good, and you?
Doing good.
What's your name?
My name is Ben.
And what department do you work in?
I work in the laboratory.
And so we're asking everybody in every department, what's the difference pre-COVID to now with the COVID workload, the amount of patients, anything, people's character, what has it done, and what do you see, and what do you deal with?
Okay, well, there's a lot to start there. Let's see, as far as the workload, definitely has picked up in certain areas. We perform more in-house testing for the actual COVID itself, which takes time. It's very labor intensive.
And then even with the test, what kind of tests are there?
Well, we test here at the moment 3 different types of COVID testing. We do an antigen test, we also do a nucleic acid test, and then we have a test by PCR that we perform in-house.
Okay.
Each of those, the PCR is the most definitive of the tests, so it can tell whether a patient does or does not have COVID. As far as the other ones, they do have some minor, let's see here, I would say setbacks. Their percentages for precision are not as high.
Okay. And what's me, I don't know, to be honest. So what does it, 1 day, 2 days, 45 minutes, 3 minutes? How long do they take?
Oh, the test, the longest one we have takes 20 minutes.
Okay.
That's just the test itself, not the prep time. It was just about 5 minutes for each one. So we try to do about 2 to 3 of those an hour at the maximum.
And how many times do the patients get tested when you do it?
Well, when the patient comes into the ER, they have we do the SARS antigen test. If that one comes up negative, then we reflex to what's called the SARS NA or the PCR. The doctor has the choice of one or the other. Sometimes we would end up actually running all 3 tests on 3 different samples if the patient continues to show up negative, just to verify the validity of the negative.
Okay.
But if the patient comes up positive, that's it, they're positive.
And then after they're positive, do you have a routine check of saying we're going to check them again, or is it more?
Yes, it's usually about 7, I think they run between 5 and 7 days. They'll try again and see if it comes up positive again or if it's negative at that point.
Okay. So what else do you see out here?
Well, in the hospital field, as the clinical, I think people are more stressed out because there's a lot more, it is an epidemic, a pandemic, that lots of people have lost their lives to this virus, and it stresses a lot of people out.
So let me ask you this. Since you guys are in your own domain, literally, and you don't, I won't say you won't deal, so is it easier for you because you're already alone out here than, so meaning, like we talk to so many people and then we have to go home and be isolated like you isolated here. Right. So is it something you're used to? How do you deal with the stress and going home? Do you take it home? Do you?
There's some stress that goes home. My wife, like when I go home, I take off my scrubs. I make sure I clean up a little bit. So if any leftover residue, we have our PPE that we wear all the time here in the facility. But we want to make sure that you don't bring it home to your family, to your friends, I think. We don't have direct patient contact here in the laboratory for me. We do have the phlebotomy who do patient contact. And so I know for them, they're more stressed out about it. It does wear on you.
Okay.
But I've had many many coworkers who have gotten sick. I've had many coworkers whose families have gotten sick. It's just,
and does it stress you out when you find out somebody in your department got sick? Like maybe I might.
A little bit. I had a coworker that got sick, and I had to be investigated also. Luckily, I was negative.
Good for you.
But it definitely, the stress has increased. It is noticeable. People a little bit more irritable.
Have you taken your shot?
I have not yet, no.
Okay. Are you planning on to?
For me, if all the direct frontliners have gotten their shots and all the appropriate patients who are in the who are high risk have gotten the shots, then yes, I'll get my shot. But
Thank you for your sacrifice. Thank you for your sacrifice.
I want to make sure they get them first. So
thank you for putting us first. And then for any future lab students, or even right now people who are graduated, but they're afraid to put in an application because they're like, I'd rather stay at my regular job than to go into front of the war and deal with this. What advice do you have for them?
Well, I mean, it is definitely an interesting time to start working. Finishing school, coming into this, I can't imagine. I've already worked 15 years in this field. I've seen H1N1, I've seen this avian flu, the swine flu. This one though is it's interesting, and I have to put my props to the students going to school at this time, wanting to get their degrees in healthcare, because you do have to become a frontliner in that sense.
Yeah.
And I'd say just keep going. We have practices in place that help keep us safe. They're not 100%, but we do try our best.
Nothing's 100%.
You're right, nothing's 100%. We do, our patients and our employees do come first. So it's how you, it is a demeanor that you have to carry with yourself.
Thank you very much.
No problem.
Thank you, have a good day.
You too, thank you.
What's up?
How's it going?
What's your name?
Eric.
And what do you do?
I am in CT, radiology.
Okay. And so the question is, or have for everybody, is what difference did you see from before COVID and after COVID?
For the CT world, it's always busy, but the level of acuity kind of went up for us. We're used to kind of seeing routine, head and belly pain, but nowadays it's more focused on shortness of breath, chest pain, trying to get real critical patients in here. A lot of CTHS, they're looking for pulmonary embolisms. They found out early on that patients that have COVID develop blood clots, and sometimes that can attribute to the shortness of breath. So CT is real vital in aiding the physicians and determining whether it's just regular like COVID pneumonia or a pulmonary embolism that's causing the severe shortness of breath. So it's gone from our normal scans where maybe non-contrast, which are kind of in and out, to the CTHS, which takes a little bit more time and kind of a little bit more skill on our end, and kind of preparing the patient. So every exam got a little bit longer.
So now do people have to wait longer to get results and things
definitely,
like that?
because when we do that, now we're waiting for labs to make sure kidney function is adequate. We're waiting for correct IV placement, and then, like I said, each exam takes a little bit longer now because you're just
everybody
bringing them in. You got to pull everything out of the room, scan them, make sure they're hooked up to oxygen, make sure the exam is good, take them out, clean everything up, gown up, gown down.
So like somebody like you said, you were here at day shift and then you came night shift. How do you deal with the lack of sleep and still have the drive? I know, we all do this to try to help people. How do you keep it's not a job to, I'm still helping people, because that's a lot, man.
It is, and I think it's making some people, reconsider their career choice in the medical field, but I feel like this is really what we signed up for. I think we knew it was a possibility. I don't really think we thought it was going to happen, but it's a little bit exciting. It's kind of fun to actually do something a little bit different, although it is very stressful. And you just have to be able to come in and just kind of focus on the fact, like, if that's you or your family member, friend, no matter how stressed the employee is, you still want the highest level of care possible. So you just have to, whatever stress you're feeling outside of work, come in here.
Separate.
Yep.
And then if somebody was interested in doing what you're doing, what would you tell them?
I would say spend a good amount of time shadowing someone, and just prepare for hard work and just learn how to manage stress more than anything, because that list in CT never ends.
Trust me, I've seen it. I'm in here sometimes. Yeah, thank you, sir.
Yeah, thank you.
Hi,
Hi,
what's your name?
my name's Kyla. I work in the neonatal intensive care unit.
Okay, so since you've been working in NICU, what have you seen pre-COVID to now that they COVID? Anything work-related, stress, anything even with the moms and the babies? What have you seen?
Yeah, I mean, initially, whenever everything was super unknown, it was a very scary time because we were separating any pending or positive moms from their babies immediately. Fortunately, we were able to stop doing that. I still see a lot of really scared parents, how it's going to affect their babies. Even just developmentally growing up, you know, babies need to see faces. We're all covered in masks. You know, babies need to see our mouth move. They can't. Lots of being scared about germs, which I don't know in the NICU land if that's a bad thing or not, but certainly we don't need any more stress on the parents. Work related as far as home goes, you know, I feel like we're all more stressed. We don't get out as much. So the stress relief, the medical field pre-COVID was a lot of stress anyway. Seeing sick babies takes a toll on you. I don't have the same normal releases that I'm used to having, and getting out and doing fun things with my kids. So I feel like my anxiety level is up. So I don't feel like coming into work extra, and especially whenever we're short-staffed and nurses are calling out because they're sick, so they don't need to be in. So I should be coming in to help out more. You know, I don't feel like doing it. You know, I'm tired and drained. In the NICU, I feel like we're fortunately pretty secluded from all the COVID patients. So I feel like I'm very, very lucky to be working in the NICU.
And when you said kids need to see mouths and all that, like, does it affect them in any way?
Very much so. It, you know, affects bonding, attachment, language development. You know, of course, they're seeing their families with their mask off at home, but kids are used to seeing everybody, you know, all the time. So there's a lot of unknowns about how that is going to affect them long term.
And are you vaccinated?
I am.
Okay.
Well, I've got my first dose. I go on the 19th to get my second dose.
How do you feel your body? Any?
I was very, I mean, to me it felt a whole lot like the flu shot. I had no side effects besides a little bit of muscle aches for a couple hours, and then I felt fine after that.
And then, so if any future nurses want to come here and do NICU or do anything, what would you advise them with what's going on, and if it wasn't there too? So it kind of like a two question.
I mean, I feel like this is the best place to be, honestly. I mean, during COVID, I would reach out there and say we're probably the most secluded from COVID that you can get.
Yeah, I had to go through 5 doors.
Right. If you're sick or you've been around sick people, you're not allowed in the NICU.
Okay. Thank you very much.
You're welcome.
Halala sanbongela, halala sanbongela we.